And that segue is perfect to lead us to a discussion related to self-insurance with level self-funding. Now, the best way to think about self-insuring with level funding is a sort of hybrid between fully insured and self-insured plans. It's a self-insured plan, but it looks and feels like it's fully insured. And here's how it works. Under a level funded plan, an insurance company or an actuary determines the claims funding amount for the plan based on an employer's historical claims, if they have access to that information, or the health risk data that they can get their hands on, and then adds in the expense to administer the plan and insure the high cost claims with some stop loss insurance, like you would expect in a self-funded arrangement. The insurance carrier then charges the employer a fixed premium based on the total required funding level. So, and then in this arrangement, if by the end of the year claims ran less than expected, the employer could receive a full or partial rebate from the claims fund. So you, in a sense, are participating from an underwriting gain, since what was expected from a risk standpoint actually performed better. If the plan runs worse than expected, on the other hand, there's no additional cost or liability to the plan, as the carrier then absorbs the excess claims costs. So you can see where this hybrid is an interesting choice, as it gives you the safety of knowing your fixed costs for the year, while also providing an upside benefit if your plan performs well, similar to a fully self-insured plan. So self-funding, like I mentioned, with level funding is a terrific option for really smaller employers who need fixed, predictable costs, but want to open up the opportunity of saving money in good years when the claims experience is better than anticipated. Depending on the carrier or the third-party administrator that you use with your level funded program, you can gain some flexibility too in how you structure and administer your plan, and you should receive more claims data. If you have a particularly healthy employee population, you may end up also paying less than what you would have under a fully insured or ACA community rated plan, as your plan's underwriting in this case will be based on your own group's claims and performance as opposed to the larger risk pool. That also leads, though, to one of the cons with level funding. Since this option is mainly used by smaller employers and is based on individual group experience and claims history, this option will realistically look less attractive to plan sponsors and carriers if there are too many high-cost claimants or significant health issues under the hood, as that poses some significant risk to the group and to the carrier. So there's a possibility that a carrier will just deny this as an option in the quoting or evaluation process. Another significant barrier to level funding is the lack of historical claims information, and I kind of spoke about this earlier. Groups that are evaluating this option tend to be fully insured. They tend to be fully insured, and they're anticipating a move to the level self-funded environment, but that also means that they already lack that comprehensive claims data. So as I mentioned earlier, really without this information, the employer needs to roll out some kind of process to get some of that information to underwrite the risk. So that's where those health risk questionnaires come in, and employees are asked to answer those questions and self-identify some of their medical history. And as I touched on, this can be a very time-consuming, disruptive, and really cumbersome process, and it requires a lot of hand-holding and explanation to employees, especially as to why this is needed. And you really need to offer some reassurances that this isn't a way for the company to identify who's sick and who's healthy to deny insurance. There's still protections for pre-existing conditions, and you need to kind of quell some of the noise and fear that might come from a population as you roll out those questionnaires.